Welcome back, my dear. It's the second part of the dementia. And here we will go now into a new aspects of dementia. And we'll go to the dementia types. Let me just remind you, in part one, which we talk about, we said quickly, we said that we have worldwide, there is one new case of dementia every 7 seconds in the whole world. Then we watched a video about the dementia and about the effect of the dementia. Dementia actually affect the brain organ, which is very important for remembering and thinking and using the mobility of body. And the brain is totally the most important organ in the whole body because it's controlling all other organs. And we saw that we have in the brain also, we have 1, 2, 3, 4, 5 parts, 2, 4, 5 parts, 1, 2, 3, 4, 5, and we have 6 parts as well. And we said, including the brainstem, we said each part of them is having functions in the body of a human. In a human body, it's having one of the functions, but sometimes more than one function for each part of these parts. And we talk about also, let me remind you, we said that aging, it doesn't mean that when I become aged that I will get the dementia. It's in the United States, every 3 over 85 years old, one of them is developing or developed dementia. We said also it's something regarding the brain, like we said, and we talk about some facts about the dementia itself. We said approximately 45 million people worldwide suffer from dementia. And those people, they will become 135 million in the year 2050. And we move also into the dementia definition and facts about dementia. And we said like this, here is the brain is shrinking. Happens shrinkage in the brain cells, and the cells which is deteriorated will never be replaced with another cells. Then we talk about the dementia definition, and we said the dementia is a progressive loss of brain. Loss of brain, what functions? Because the brain is only for functions that affect the ability to live and increase dependence. And in the last stages of the dementia, or the third stage, we said that the patient is not able to serve himself and he's totally dependent upon the others. We talked also in the previous lecture about the dementia prevalences, and we said it's in women more than men. So this line is about men. And you can see in 2017, how many cases had been attacked or developed dementia. You will find that the females are more than males. Here is the line of the females. You can see it. It's more than males have this kind of disease. Of course, it interferes with the ability to perform activities of daily living, ADL. The ADL here is affected totally when a person has a dementia or developed a dementia. Also, it affects about the person morally and emotionally, and include even everything: insomnia, wandering apathy, and aggression. He becomes more aggression and no tolerance. He doesn't tolerate, and he's agitated, and he acts it was different ways for the same event or same action. He can't remember, he has problems with his memory, and so on. That we said also that dementia will affect the following: the memory, the insights, the ability to plan, information processing, ability to reasoning, language skills, filtering systems, orientation, spatial. And this is not everything. Also, the patients with dementia, it affects on the behavior of the people, and the patient cannot understand what's being said. They respond differently, and also they show strong emotions like frustration, rage, and withdrawal from situation. They also withdrawal from situations like, and also sometimes the patient behavior can harm the patient himself and other people around him, his beloved people or something. This may happen because some needs like physical and emotional is not met. And in the previous part of this curriculum, we talk about 3 questions was there, define dementia, and discuss the numbers, the dementia worldwide, how far is the dementia, like we said, every 7 seconds, there is one person develop dementia, and which is affected, men or women. We said women are exposed to dementia and developing dementia more than men do. And we should also discuss the consequences of patients who develop dementia, how the other problems which he has. Dementia types. We'll see today that we have actually 2 types of dementia, reversible and irreversible. Those are the main 2 types of dementia, reversible and irreversible. So what is the difference between the reversible and the irreversible dementia? The reversible means can be treated and can be recovered. This is in very simple words, can be healed. People can return back and it's something occasional and it will go. And then the people, the person who has this kind of dementia will get back to normal or back to track. But the irreversible, you cannot, this is kind which is progressive and it will never get back to track or never get back as it was before the dementia. So reversible, like depression, delirium, emotional disorders, metabolic disorders, hypothyroidism, from hypothyroidism, and eye and ear impairment, tumors, infectious, alcohol, drugs, and so on. Reversible, like dementia, like the Alzheimer and Parkinson, and we will talk about them right now. But before we go there, usually it's the vision, the picture or the video can say a lot. So we will say here types. We'll look for a video that will tell us the types of dementia. And we'll see there types of dementia disease. I think we don't need a very big long video. We can see a small one will tell us about the dementia and the types of dementia. Here we go. Types of dementia. Let us go here, but this is very long. Of course, vascular and Alzheimer's, but we want something which can help us. Let's go here and see this one.
Hey everyone, it's Sarah, registered nurse, RN.com, and in this video, I'm going to be going over Alzheimer's disease. And as always, whenever you get done watching this YouTube video, you can access the free quiz that will test you on this content. So let's get started. Alzheimer's disease is a chronic brain disease that is a type of dementia, and it's actually the most common form of dementia. And the reason it occurs is because neurons, which are specialized nerve cells in your brain, which help you do almost everything that you do on a daily basis, from form new memories, learn new things, solve problems, make judgment calls, even with your language, being able to understand language that's spoken to being able to actually speak it. They lose the ability to communicate with one another, and then eventually they die. So why does this happen? Well, it actually happens over a period of time. And the reason it does is because of a couple things that I really want you to remember, because it's going to be the foundation for understanding the pathophysiology of Alzheimer's.
So what I want to say here, regarding this video, what I want to say that we have dementia that might be treated, which we said that we have 2 types, like we said, reversible and irreversible. So the one which can be treated or reversible that can be treated and someone reverses as, it's like the metabolic process gland can lead to disorientation or to delirium. The thyroid gland, which is here in the neck, like you know, if it is disorder, this also will lead to some problems of deliriums or disorientation, both of which can be reserved when the thyroid condition is corrected. So once the thyroid have been treated with medications under prescriptions like levothyroxine or other medications, in that case, the delirium will be gone and things will be back to track again. So situation will be better again and the patient will be fine. And no more complaints about any kind of dementia or whatever, or memory loss, or affecting on the motion or the activities of a person or so on. Some brain injuries result in internal bleeding in the skull, which can cause a rapid onset of dementia symptoms, okay? But if he's healed up, from this brain injury, everything back to track and everything will be fine, and it's not progressive dementia in this case. It is not progressive dementia in this case. It can be healed and can be treated. Brain tumors also, delirium or dementia may result from brain tumor. Okay, alcohol, long-term alcohol abuse can lead to dementia that may or may not be reversible as well. Nutritional deficiencies, like as example, vitamin B1, B3, B12, which is the lack in these three kinds of vitamins, B1 and B3 and B12, can lead to a kind of dementia like mental impairment. Some infections also might affect on the brain functions, but once it's treated, everything will be back to normal, and there will be no any problems regarding the dementia and the dementia. As example here, tuberculosis or wound can cause disorientation or delirium, which can be reversible if treated. If treated, it can be reversible, means can be healed up, and the situation as there was in nothing, and everything will be back to normal. Poisoning also is one of the reasons for the, what we said, reversible dementia. Sometimes the poison, as example, or the poisoning. Environmental exposures and ingestion of lead and other heavy metals, or abuse of the pollution, what's happening from the pollution, and abuse of substance, cognitive and behavioral changes, often mistaken for dementia. So once you get all these factors away, all these reasons away, then everything will be back to normal and everything will be fine. So what I want to say here again is that we have two types of dementia. We have reversible type of dementia and we have irreversible type of dementia. For the reversible type of dementia, like it's depression and delirium, emotional disorder, metabolic disorder, hypothyroidism, and the eye and ear impairment, and so on. But once you are treated and took prescription and everything's fine, then everything will get back to normal, and there will be no more complaints about the developing dementia. But if it was irreversible, in that case, we are in a big problem, because this is the irreversible is a progress and can get back to track. And we said here, now those are reversible, like metabolic problem or brain injury or brain tumor or alcohol long term. It may be yes and maybe no, maybe reversible, or maybe the alcohol may be reversible or irreversible. Nutrition deficiencies, we said the vitamin B1, B3, and B12 are very important also, and they are determinant factors regarding the dementia. Infectious also takes the same alike, dementia alike, and also the poisoning or the environment if it is not clear. That was the reversible. The reversible means can be healed up and can be treated. But we have also types irreversible forms of dementia. The reversible forms of dementia include the following: Alzheimer disease and related dementia, Alzheimer's disease and related dementia. Alzheimer's disease is very famous, account for 64% of all dementia in the Canadian society. So 64% of the dementia is due to Alzheimer. Alzheimer is a reason to get the dementia. Okay. Here we go now. What happened? I couldn't see 64% of the dementia is due to Alzheimer. So what will happen here? Memory loss, affecting the abilities, the ADL or daily activities, difficulty performing familiar tasks. The patient will feel that he cannot do things that he used to do before. So he will forget how to do the things in his own life and how to prepare, as an example, the meals and so on, and how to get dressed. So he will forget how to get dressed as well. Problems with languages, forgetting words or substituting words or so on. He might forget some words also. Disorientation in time and space, not knowing what they do, and they lost information. They will be like, as example, he doesn't know driving, where he's going. He doesn't know how to drive or forget about driving, and so on. He might forget about days and so on. Also, impaired judgment. We said now this is actually attacking all the parts of the brain. And each part is responsible about one function or two functions or three functions. Now you will attack the brain, so you will attack these functions which in front of you. Impaired judgment as well. Also, problems with abstract thinking. The patient cannot think properly or cannot think well. Misplacing things, putting the stuffs not in their own place as he usually do in the past. When he comes, as example, you put the key on the hole or on a nail, or you put it on the table. Now he will put another place and he doesn't forget. He will forget where did he locate it? Where did he put his keys, the car keys? Changes in mood and behavior. And this is also an example. As example, I was a very easygoing person. Now I become a very quick-tempered person. It's very nervous, very easy to be provoked and to shout and so on. Usually occurs after the age of 65. Is often diagnosed after 80. However, it can also affect people in the ages of 40 and 50. Now there are some people who has Alzheimer's in their early stages of their life. Okay, that was the Alzheimer. The second type of dementia is called vascular dementia. What about the vascular dementia? Vascular dementia, sometimes known as multi-infarct dementia, one of the most common forms of dementia, second only to Alzheimer. So the Alzheimer comes first, then second, the vascular dementia. It comes attack the older adults. Vascular dementia is caused by chronic reduced blood flow to the brain. Now, the amount of blood which goes to the brain is less. The amount of blood which goes to the brain is less here. For that reason, we call it's a vascular, because the vascular is including the veins which carry the blood. So here, vascular dementia is caused by chronic reduced blood flow to the brain, usually as a result of stroke or series of strokes. So once like you hear about someone had a stroke, then he's not focusing, he's not conscious in what he's saying, he doesn't know a lot of things which he's saying and so on. So this happened with the stroke. Usually the vascular dementia happen with the stroke. However, there's some improvement in some people I know when they are exposed to stroke and the memory start to be like deteriorated. Then with the medication and so on, things comes better, like, but never go back to normal, like, to the way it was. Okay, vascular dementia results in what? What are the consequences? Subtle progressive decline in memory, and by carrying oxygen and nutrients to the brain is interrupted. Interrupted means less. The amount of the blood which reach to the brain is less by blocked or diseased vascular system. The vascular dementia may come on gradually or suddenly, and the speed of progression varies from one person to another person. So this is very important, the vascular dementia. Like you see here, may come on gradually or suddenly. As example, someone got a stroke. All of a sudden, you heard about someone who had stroke. It's happened all of a sudden. For that reason, it didn't come gradually. It did not show up gradually. It showed up suddenly. There are any symptoms for the vascular dementia? There are any symptoms for the vascular dementia? Yes, there are. There are some, like what? Slowed thinking, memory problems, unusual mood changes, from hallucination, like talking things like and delusions, things is like unbelievable that he's talking or he's saying things like not feeling what he's saying. Disorientation, which may get worse at night or when the sun down. Yeah. So these are the points of the first two types. Let me go now to Alzheimer's because I just want to go for Alzheimer's disease and types of dementia. We want to run types of dementia.
So many things to coordinate. Yeah.
Like you see here, dementia is a set of symptoms which include loss of memory, understanding, and judgment. These are the types of dementia which we are talking about. Again, I'm just explaining reversible and irreversible. The reversible, like medication side effects, nutritional deficiencies, metabolic disorders, depression, delirium, sleep disorders. This is reversible, means can be healed or can be treated or can get back the situation to normal. But there is irreversible causes like the Alzheimer's, Lewy body dementia, vascular dementia, which we mentioned till the moment, Alzheimer and vascular. Front temporal dementia and mixed dementia, which is mixed of all of this. The reversible dementia like depression, medications, nutritional disorders, metabolic disorders, and other conditions, and we talk about it, so we said the poisoning also on the outside. But the irreversible dementia like progressive disorder, vascular dementia, subcortical dementia, head trauma, infectious diseases, this can leads to irreversible. The Alzheimer's, which we are talking about right now, I'm just repeating what I said again. Most common forms of dementia occurs in approximately 64% of cases of dementia. 64% goes into Alzheimer. Gradual progression eventually affects all areas of the brain. So it is progressive because it doesn't stop. It goes more and more and more. And the case on the position or the status of the patient will get worse and worse and worse. Discovered by the name of the doctor who discovered his Alzheimer in 1906. Type Alzheimer has warning signs. I mean, by other meaning, things or the symptoms when I feel it or I encounter it. That means I am going to be Alzheimer patient. I will be like Alzheimer patient or not. So like an example here right now, the 10 warning signs. First of all, the memory loss that affects day-to-day abilities. We have also difficulty in performing familiar tasks, as example, forgetting how to do things, some things, as example, how can I fry the eggs, what I will put in the eggs, and so on, how to do like here in the figure. You have been doing something you're doing in your own life, now you start to be confused and you don't know what to do about it. Problems with languages, as example, forgetting words or substituting words that don't fit the context. So I put words instead of the words which should be proper. I will not use the proper words. I forgot the proper words and I'm replacing it with another words. This is the problem of languages. Disorientation in time and space. Not knowing. So as example, if I go out, he might lose his way. For that reason, sometimes when we were working in nursing homes and residentials, they used to put the title or the address to the patient, so that if he goes out, the door was opened, or he fled out of the door, or he went without anybody feel him, and he went on the roads, anybody will see he wrote in his, like, we wrote to him in his own purse the address, so that if someone saw him, he will know the address and he return him back or return her back, whatever. The reason is that in this stage of Alzheimer's, the patient will not be able to will have, or by other meaning, will have disorientation. Means like he will forget about where he's living and where he's going and so on. So knowing what they or is getting lost in the familiar places, which you know it very well, impaired judgment. So not recognizing a medical problem that needs attention, or wearing light clothing on cold day. So as example, I'm wearing, as example, I know now, impaired judgment. I know very well that the regular person will warm his body by putting on winter clothes if he's going in the snow or whatever. But here the situation is the opposite. So he might go like without any pieces of clothes or just with light clothes in snowing weather. And that is another thing which is impaired judgment. Abstract thinking as well, like as example, the mathematical operations and so on, understanding the numbers and how they are and how to read them and so on, misplacing the things, putting the things not in its proper place, changing mood and behavior, always severe mood swings, like from being easygoing to quick tempered. This is another point. It changes in his personality, behaving out of character. All these for the Alzheimer, such as becoming confused, suspicious, or fearful. Loss of initiative, losing interest in friends, families, and people. So the social needs for the person who developed Alzheimer, the social needs for him will go to the zero level. He doesn't care about any others around him. He doesn't know who's around him, and he doesn't care about them, like friends, family, relatives, and so on. he loses interest in them. In these figures, you can see the difference between the healthy brain. This part is the healthy brain. And this part is the advanced Alzheimer's. Like you see here in front of you, you can see the cavities here. Look at the cavities here. The brain image comparison shows atrophy in the gray matter tissue. In the gray matter tissue. See here, brain atrophy or shrinkage. There is a shrinkage. Can be seen on MRI or CT scan. There is when they make for an MRI or CT scan, they can see the shrinkage. I will go back to this part and see here.
Actually shrinks and affects the function of the brain. The brain can shrink up to 2/3 of its original size and weight over the course of the disease process. So now that we...
As you heard, 2/3 of its own size. So the brain, look at here, the brain, this is the size of the brain, and look here, there's shrinkage in the size of the brain. The brain itself shrinked in the Alzheimer patient, shrinked into 2/3, means lose 1/3 of its size.
Understand what's happening kind of at a microscopic level. We're going to look at the physical changes to the brain caused by Alzheimer's disease. And we're going to start with the image on the left side of the screen. This is an MRI image, and it shows a comparison between a healthy brain on the left and the brain of a person with advanced Alzheimer's disease on the right. You can see the red circle, that the dark area is larger in the person with Alzheimer's disease, which indicates that brain tissue has receded. So it's getting smaller, it's depleting. On the right side of the screen is a comparison of the gray matter in a healthy brain on the left and a brain with advanced Alzheimer's disease on the right. Whenever you see spaces and shrinkage, that's a loss of functioning to that particular spot in the brain. This shrinkage directly translates into a change of behavior, function, or ability that the particular part of the brain is responsible for controlling.
So these are regarding the Alzheimer's, and the figures show Alzheimer's as well.
We went through these 10 warning signs I was talking about.
Now into the second type, which you said is called the vascular. So what is the issue about the vascular? Vascular, we said that the amount of blood which reach to the brain from the veins is insufficient. The amount of blood which reach the brain is insufficient or not enough, caused by damage to the brain from lack of blood flow or bleeding in brain. Can be consequences of a stroke or cerebral small vessels disease that cause narrowing or damage to the brain's blood vessels. Changes in the ability to make decisions or to plan or organize may be the first symptoms to appear. Again, changes in the ability to make decisions or to plan or organize may be the first symptoms to appear. Okay. We're talking about the vascular. Still, we are talking about the vascular itself is having also types. So there are types for the vascular dementia, like subcortical dementia. Small vessel disease cause blood vessels to become stiff and twisted. Can damage the nerve fibers that carry signals around the brain, known as white matter. We have also cerebral cerebral amyloid angiopathy, and this is amyloid accumulates inside the blood vessels, similar to Alzheimer's disease. Also can lead to a stroke or blood in the brain. Let's see also here. There is symptoms for the vascular dementia. Can the vascular dementia patient has symptoms? Yes. Change in the ability to make decisions and plans also. He won't be able to make plans and won't be able to think. Difficulties with movements, mobility problems. Like as example, he has poor balance, he cannot stand or whatever. A specific impairment may occur in steps where the person may experience a deterioration in their abilities. It may stabilize for a time and then decline again. Sometimes it will be okay, then again it will go back to worse, known as stepwise progression. Stepwise progression. Okay. That was the first two types. We are not going to the mixed dementia in this part right now, but we talk about Alzheimer's and we talk about the vascular dementia. Alzheimer dementia, and we talk about the vascular dementia. Shall I stop here right now and just go into, we said the effects, and we said also the types of dementia here, Alzheimer dementia, frontal lobe, lobody, and other types of dementia. Alzheimer's dementia, the most common cause of dementia, 75%. Dementia can also occur after strokes, and this is the one which we are talking about, which is the vascular one. A person can have more than one type of dementia. Yeah, a person can include more than one type of dementia. We said also we have dementia for the nutrition, which is can be corrected or can be fixed, which we call it reversible dementia. This figure, it show me, let me just reduce it a little bit. We have here the front temporal dementia. Like, first of all, that the Alzheimer's dementia is the major one, which is most of the cases between 60 and 70s of all the patients of dementia comes from Alzheimer, 60 to 70%. The vascular is from 10 to 20%. And now I think this ratio also is going down because the people has conscious and have awareness about the medication and the importance of medication, especially to avoid strokes and so on. So vascular dementia is from 10 to 20%, and Alzheimer dementia is from 60 to 70%, which is the major, like you see here, the Alzheimer is the major reason for the dementia. Alzheimer is the main reason for the dementia. Don't forget that the dementia is a total, and and inside it will come the reasons for dementia. Reasons for dementia may be Alzheimer, maybe vasculars, and maybe front temporal, and so on. Front temporal is 10% only. Here it is, the front temporal. Dementia with Lewy bodies, 4% only. So the majority is the Alzheimer, like what you see here, then the vascular dementia. Again, types of dementia here, Alzheimer's disease, which is a major, like around 70%, vascular dementia, dementia with Lewy bodies, and front temporal. We will talk about those two in the second part. Here in this figure, it shows me that the Alzheimer, see the size of the Alzheimer, and see the vascular, and the others are part consider small parts when you compare them to the Alzheimer. It means that the most common reason for the dementia is the Alzheimer. Yeah. This is person with dementia. Persons whose dementia is caused by Alzheimer's disease. So the others are vascular dementia. Here, I'm gonna stop here, and I'll put new slide and say compare between Alzheimer and vascular dementia. Compare between Alzheimer and vascular dementia. And that's the only question today, because we discussed the meaning of Alzheimer's dementia, and we discussed also the meaning of vascular dementia. That's all. And what the relationship between both? Compare between Alzheimer and vascular dementia. Thank you so much. I will wait here for about 5 minutes before I move for you guys to collect an ideas about the question which is left here and what we will write in it. Thank you so much. Oh.